Hi there, I'm Dre, the host and founder of the Dragon Network, an online member-based community where health IT professionals can share ideas, discuss experiences, and collaborate with one another on all things related to health IT. In this week's video, I want to talk about a concept that's been coming up a lot lately with respect to cybersecurity. So cybersecurity is by no means my area of expertise, but I do hear a lot of conversations around security and around the requirements in different projects that I've been working on, as well as with operational endeavors and interacting with architecture review boards. There's a term known as zero trust that keeps coming up in the technical and cybersecurity discussions. And from a general build analyst perspective, or from an adoption lead perspective, or from an IT end user perspective, it can be kind of confusing. So I thought I would summarize a high level of what zero trust actually is and where that concept is sort of leading everybody. Before I get started, if you haven't had a chance to subscribe to the channel yet, go ahead and do that now. And throughout the video, if you like the content that you're seeing, please hit that like button so that I know and that I can gauge what types of videos you guys are interested in seeing in the future. To get started with the conversation on zero trust, I actually want to talk about why healthcare organizations are such a target for cyber criminals, or for bad actors, as they're often known as. So why is it that they're trying to break in and steal our data as opposed to everyone else's data? There's a few key reasons for this, and these reasons aren't anything that's going to change. They're just going to continue over time, so they're good to be aware of. So first and foremost, we have a ton of connected devices, and that number just keeps growing. We keep adding more technology into our ecosystem, and we keep expanding the ecosystem that we're looking for data exchange and things like that. As we bring more technology in, we're adding more and more points along the way. Healthcare is also an incredibly high priority and critical type of service. So we have a very, very little, if any, tolerance for downtime at all. We need to keep those systems up and running. They are critical to providing care for the population, and therefore they become a high target just because of that. The next one I think is going to take us quite a while to sort of deal with, and I'm not sure if we'll ever get out of the loop, but healthcare, due to budget constraints and just availability of resources, we tend to have quite a few legacy applications inside of our IT environments. And those legacy applications sometimes can be several years old, and it can be difficult for some of those legacy platforms to keep up with all the security demands that we have today. So those legacy applications present a risk for us, and they also present a very attractive target for bad actors or cyber criminals. And last but not least, the data that is contained within a health organization's system is incredibly rich data. So it is personal data that contains all sorts of information about the individual's health, and it usually also contains financial data. So there is a twofer there that is housed within the same systems, especially when you're looking after core. That makes it very attractive. In a recent article that was written by David Kelly for Forbes magazine, it was estimated that one healthcare record, so one individual record, was worth about $250 on the black market. And that may not seem like a ton. However, it is when you compare it to the next highest record, which is $5.40, according to this article. And very rarely when someone is attacking a system would they go after one individual record. In fact, in the year ending August 31st of 2021, there were 707 reported breaches of healthcare data that contained 500 or more patients per instance. So that is a massive amount of data at that $250 per record value. So zero trust, what exactly is it? How do we figure it out? So the concept and the term comes from an individual that was working at Forrester Research by the name of John Kindervag. And when he was looking at this concept, in creating the zero trust concept, he really based it on the principle of never trust and always verify. And that's because trust can be exploited when it comes to IT security systems. If you trust that everything is always good and nothing can ever be exploited, that every actor that's in the ecosystem is a positive and rule-abiding actor, that trust can absolutely be exploited, and that's what he wanted to focus on. So the belief that everyone inside of your network, or anyone who makes it into the network, is a reliable actor who can be trusted and is going to follow the rules, actually assumes that no one could ever impersonate someone else, or that nothing would be compromised. And that's where we tend to have in the past gone wrong. And of course, All of this is evolving. And it's not like it was an intentional omission at the time. It's just cybercriminals are becoming much more savvy in keeping up with what's going on. And so they leverage actors inside of the network with phishing scams, with all sorts of things to actually impersonate or play that role or have someone let them in, again, unintentionally. By and large, the vast majority of cyber attacks are not something that is intentionally done by someone inside the network, but the network has someone who participates or a device that participates in allowing that bad actor in. So with Zero Trust, you want to make sure that you authenticate all users and resources, that you are authorizing access to specific systems or specific environment processes, and that you are continually validating that as things move forward. Deploying Zero Trust architecture isn't something that you can just go out and buy a system and sort of put off the shelf. So when you're hearing Zero Trust in your organizations or when conversations are happening around Zero Trust, keep in mind it's not just one thing that's going to get deployed. It is an overarching strategy that's going to be applied to one or more systems. It's going to require tools and platforms that really span a whole bunch of different areas. Looking into information that's out on the web on Zero Trust, there are 7 main areas or categories that are typically listed as being part of the Zero Trust sort of bundle or layering process. And those are device security, network security, data security, workload security, identity and access management of users, visibility tools, and orchestration platforms. So when deploying a Zero Trust strategy in the organization, it is important to keep in mind that it is not likely to be applied across everything in the ecosystem. So when you talk about everything in the ecosystem that's connected, that would be your attack zone or the attack layer that a cyber criminal or a bad actor could hit. And that area is just growing bigger and bigger if we look at things like telemedicine connection, remote working, the wearable devices that patients have, Internet of Things connected devices. It's just getting bigger and bigger and bigger. So where Zero Trust is actually going to focus is on your most critical infrastructure and your most critical systems. That's where organizations are focusing, putting in these policies and these tools and these applications first. And again, there's going to be a lot of them. So if you're listening to sort of what's going on in the technical world and a Zero Trust strategy is being deployed, keep in mind that it's going to be multiple changes and multiple things that occur over a period of time to actually get to where they want to get to. It's not just a one and done, on this weekend, we're going to implement Zero Trust. So we have the giant attack surface, and you're going to identify what's known as a DAAS or a DAS for short that will be protected with your Zero Trust. And the DAAS stands for devices, assets, applications, and services. So you're going to identify what those critical ones are. Where does the main protection from intruders or exploitation or breaches, where does it need to reside? What does that look like, and who's in that specific protected area that you're going to put a micro perimeter around? So I am not what I call a technical wizard, and certainly don't configure in the space of database administrators and security experts and that whole world. I'm not going to dive into the technical aspects of it, but you can look, and I will link below, to several different slide decks and pieces of information that are out there to get an idea of the types of things that your technical teams will actually be deploying. And you may also hear terms like next generation firewall and things like that thrown out. And this is really what they're referring to when they're talking about those things. They're all tied back to putting this micro perimeter in place around your protected surface for the Zero Trust policies. So Zero Trust is all about proof. Just keep that in mind. So it's all about proving who you are, proving whether or not you have the ability to access, and then continually proving that you are who you say you are throughout your work in the applications or in the systems or environment. It is tied to the NIST 800 series requirements from an actual technical standards perspective, and the key principles that are incorporated into those NIST guidelines are continuously verify access all the time for every resource that's trying to get into that protected zone, to limit the blast radius, so to minimize the impact if something were to happen. So if there is a breach that occurs, internal or external, that you can contain it and that it's not going to leak out to your entire organizational ecosystem, and to also automate context collection and response. So make sure that there's behavioral data and that you can understand for the entire IT stack that you're looking at in that protected zone, who's doing what, who's expected to do what, and where you can see anomalies occur. So to summarize, zero trust is something that more and more healthcare organizations are looking to implement with respect to their architecture, or are looking to third-party vendors to help them implement for a defined number of devices, system, applications, and assets. So they're going to identify those core things that they need to put zero trust framework around, and where you're really going to put in place by policy and by architecture a system where your default is going to be to not trust devices, users, systems, or workloads unless they can authenticate, authorize, and continually validate who they are and what they're doing in that protected zone that is, protected by the zero trust strategy. So it seems like an extreme way to go, and it is likely to result in some changes from an end user perspective. So things like turning on multi-factor authentication for more applications, having shorter logout times after inactivity, removing situations where there is a generic login that is going to connect multiple devices, things like that. So you'll start to see little changes. But if you're on an IT team, keep in mind when a zero trust strategy is deployed, there's a lot of activity that will occur on the technical side, and it is really looking to just protect that micro perimeter or protected zone within the ecosystem as much as it possibly can, so we don't have data breaches or bad actors inside that system. We don't want any more ransomware attacks. We don't want any of that to happen. And we want to make sure that we're investing our time, money, and efforts as best we can to make sure that we can thwart those attacks. So I am going to put a whole bunch of links in the description below if you want to read more about it. If you are more technical, some of them also have references that you can link back out to, so you can dive into sort of what types of specific policies and stuff you might want to look into, what tools and architecture may be considered. Again, I'm not a technical expert, so I can't focus on that area. But just in the application space and in the IT world, I thought it would help to touch on what zero trust is and why everyone seems to be talking about it lately, so that you can understand what it is that is happening on those technical teams. That's all I have for this week, and I will see you again next time. Have a great day.